Hello students, so continuing with the healthcare as a service sector. So intensive care unit is also one of the is also one of the most important service which a hospital provides to its patients. So intensive care, it refers to the specialized treatment given to patients who are acutely unwell and require critical medical care. So an intensive care unit, it provides the critical care and life support for acutely ill and injured patients. So unless you are an emergency admission, you will need a referral from your doctor or specialist to be admitted to ICU. So in ICU, you get only those patients, who are very much critically ill, which require close observation and special care. So mostly the patient who visit the emergency department, and like for example, I gave the example of the critically of the cardiac arrest patient in my first video, that if once the patient is being stabilized, the patient will require a lot of observation, so that patient may be shifted to an ICU depending upon his condition. And however, in case of road traffic accident where the patient is very much injured, and also in that case we always prefer to shift the patient to the ICU where they get the intensive care. And but hardly, it's very less that a patient goes to an OPD and then the patient gets transferred to the ICU, because since most of the patients coming to the OPD are stable patients, and moreover they are not critically ill, and they do not require close observation. So, and mostly they are planned procedure patients, so they can be shifted to a normal cabin and all, because in cabin also the observation is there, of course. Yes, the patient are looked after. However, in case of patients where suddenly the patient might collapse or something like that, in that case it is preferable that we shift the patient to intensive care. So only those patients are kept where you require a 24 hours nursing service and doctors present over there, and you need 24 hours monitoring, cardiac monitoring of the patient, airway, breathing and circulation monitoring of the patient, and also may require other support services also, like maybe ventilation support. Then so this kind of patients are mostly kept in the intensive care. And the team of the intensive care, it is consist of a multidisciplinary team. They are very highly skilled nurses, doctors and specialists who are specifically trained in clinical care to handle various patients from various patients who are suffering from medical emergency, surgical emergency, or any trauma conditions. Okay. So the next service which the hospital provides is the operation theatre, so which is one of the most important department, and we all know that it is a department which mainly takes care of those patients who undergo surgery. So operation theatre is a dynamic and complicated area where the safety of patients undergoing surgery requires a great priority. The rapid development in technology, medicine and nursing have led to new increased needs in the main management of the operation theatre. So in operation theatre, those patients are kept, two type of patient mainly are operated in the operation theatre. First of all, who are having a planned surgery and who get admitted the previous day of the operations, get their pre-anesthetic checkups and all, everything is done, and then in a particular period of time they come to the operation theatre and get their operation done. The second type of patient which comes to the operation is through the emergency department. That, for example, if a patient comes to the emergency department with a road traffic accident and which requires emergency craniotomy or any spinal surgery or something like that, in that case these emergency patients are shifted to the OT, and they are being operated in between those surgeries, and those planned cases are shifted before or after the emergency cases. So the staff who are working in the operation theatre are also very much skilled, so that they can take care of patients who requires emergency treatment. There are different type of operation theatres. In fact, like there are operation theatre which are mostly equipped for undergoing cardiac surgery. There are certain theatres which are mainly for neurological procedures, and there are also general operation theater where all the other surgeries which are related to GI surgery or maybe orthopedic surgery are being conducted. So that of course depends upon, and the human resource are also trained likewise. So I hope I'm clear till now, and and it is understandable that you have got some idea about what are the services a hospital provides. Thank you so much.